In December 2015, 40-year-old Fatimah Nakayima checked into Mulago National Referral Hospital in labor. Upon arrival in hospital, Fatimah was advised on a C-section, which indeed was performed on her in the same facility. On recovering from anesthetic procedure, Nakayima was welcomed with the bad news of the passing of her child.
She was informed by the health worker that she gave birth to a baby boy who weighed 3.5 kilograms and that this boy died shortly after birth.
Even with this kind of news, Nakayima was dismayed that the medics could not even produce the body of the baby. To add injury to the wound, Nakayima's husband accused her of infidelity and lying about the baby dying, yet she could not even produce the dead body.
When she asked for the body of that baby, she was informed that it could not be traced. The baby or its body has never been found up to date.
With advice from friends, Nakayima approached a number of non-governmental organizations, including the International Federation of Women Lawyers, FIDA, that offered to stand with her in her confusion and despair. FIDA introduced her to Center for Health, Human Rights and Development, CEHURD, and jointly pursued a legal battle for over 7 years that concluded in favor of Nakayima.
After over seven years of litigating the case, the High Court of Uganda, through Honorable Justice Philip Odochi, recognized and upheld the fundamental right to health and ordered that the failure of Mulago National Referral Hospital to give Ms. Nakayima Fatumah her baby after birth and to provide her with information concerning the whereabouts of her baby, dead or alive, is a violation of her right to health.
It is against this background that the Center for Health, Human Rights and Development, CEHURD, advises government on the need for high-quality security services in both public and private hospitals to guard against such eventualities.
What we are really interested in is systematic change. Systematic change to the point of government health facilities and private facilities with the overall mandate of Ministry of Health being alive to monitoring health facilities to ensure that there are cameras. We've had cases before of this nature, that the medical officers in charge have proper data and records, that should anything happen, it's easy to trace what went wrong.
Dorothy Amuron, the acting Deputy Executive Director CEHURD, cites this as one of the many cases they have handled, appealing to the medical fraternity to work within the professional ethics.
Mrs. Nakayima here today is just not a single person that you're seeing here. She's a voice that is representing the bigger numbers out there that have probably not made it to hospitals or whose cases have not come before our attention. One, probably because they're not privileged to even afford means of transport to even come up to Kampala, for example, to seek some remedies, legal remedies.
A 50 million shilling compensation notwithstanding, Nakayima's journey to discovering the actual whereabouts of her baby may remain a mere tale following the conclusion of the matter in court. For now, CEHURD pledges to continue offering psychosocial support to Nakayima. Dorcas Kimono, UBC News.